Bacteria are single-celled organisms found almost everywhere on Earth. Infections caused by these organisms can affect your skin, brain, blood, and other parts of your body. Some are transmitted from animals to humans. These are called zoonotic diseases, an example of which will be documented in this episode. Brucellosis, an infectious and contagious zoonotic bacterial disease infecting humans and animals alike, was first ever discovered on the island Malta. The first case of brucellosis reported in South Africa, however, occurred in 1913.
Beware aware, folks, of a new disease that has just been discovered from the agricultural field. This disease has been affecting your cattle, goat, pigs, and sheep, and all these products that are produced by these farm animals, and it has just been named brucellosis, since it comes from a bacteria named Brucella. So, folks, it has also been discovered that it can also be found from dogs. So, really, will think twice before petting a so-called man's best friend, because you might never know, as it might be your enemy. This disease, folks, it acts like a thief at night. It steals and robs animals of its nutrients and oxygen, as this disease attacks silently, invisibly, destroys, and kills. So when it comes to its transmission to humans, it can affect any part of your body, including your reproductive system, your liver, your heart, and your central nervous system. This chronic brucellosis can cause many complications in one organ or throughout your body, depending on its preferences. Causes symptoms similar to those of a fever at most.
It just happened that people were flooding at the hospital with a severe flu. The treatments weren't working. After a relapsed patient, our extensive tests pointed to Brucella.
At first, I didn't know about brucellosis. Thought it was just common flu, joint pain. But due to the disease still being unknown, I had to go to the doctor, spend whatever little money I had left on medicine and treatments, especially after I relapsed and had to go to the hospital.
I noticed changes in my cattle. They were getting thinner, the calves were still warm. I just thought it was something in the water. The radio spoke about brucellosis. That's when I figured, that's why my cattle is sick. We're infecting the people.
As our other patients ended up neglected, the hospital had to give out a large sum of money to transfer patients to other hospitals and to receive better resources.
This impacted my family tremendously, and other families presumably like mine.
Production dropped as our cattle was dying and not reproducing. As one of the only townspeople had to look for other means to get food. Our meat goes straight to my wife's butchery. We had to stop sales. They had to take our milk off the racks because it was pasteurized.
Being poor and the only breadwinner in my family.
We are poor people from Falpinsbos. It's expensive. Our quality of life has dropped.
Over the past few decades with brucellosis, human brucellosis treatments, like many infections and diseases, started off unsuccessful until its final successful try in 1986 and is still used to this day.
Did you know that not only can you get brucellosis from drinking contaminated milk products, but also from inhaling airborne agents of animals in labor?
Really? Then that explains why most cows have been vaccinated against brucellosis. It actually prevents people from getting sick.
I'm surprised they were able to create a vaccine because brucellosis is well adapted to acidic pH levels, low levels of nutrients, and low levels of oxygen.
And its virulence factors being lipopolysaccharides, type 6 secretion system, as well as BVRS system, it was hard to create.
I suppose that makes sense considering the bacteria has no capsule or flagella.
Unfortunately, though, it has proven difficult to actually create an effective vaccine for humans due to the complexity of the human brucellized species.
But prevention is always better than treatment. So to all the people who work in meat industries or agriculture industries, please make proper use of handling procedures.
Human brucellosis can be tricky to diagnose, as the symptoms displayed from infected individuals may go unnoticed.
Good day, ladies and gents. Unfortunately, I'm sure you've heard the news of brucellosis disease running wild in our food and farming industries. Scientists have said it to be a dangerous one, and our hospitals are filling up fast with patients who have been infected. Us doctors are here to help you to try and be more aware of the signs and symptoms of brucellosis and how to treat it. The disease is seen to have a wide range of symptoms, and some of which can last for a very prolonged period of time. These symptoms are a tricky one, as they're very similar to flu-like symptoms, such as fever, sweats, excessive tiredness, loss of appetite, joint pain. So if you know that you have any of these symptoms and have been around any animals or person that has been infected with this disease, feel free to pop down to the hospital. We'll get you checked out, run some tests to see if you are infectious or not. If by chance you do have the brucellosis disease, don't stress. It can be treated with a 6 to 8 week course of very specialized antibiotics. Unfortunately, there's no vaccine yet to prevent one getting the disease again, but the antibiotics will better your chances of having it worse or relapsing from still having it. So be sure to stay away from those animals or any unpasteurized dairies and meats, and stay safe out there.
Stay tuned for the next episode as we continue to explore the infectious relationship between man and the rest of the animal kingdom.
Oh, wacht, laat ik het
Drop. Yo.
It's expensive.
As well.
infected my stomach.